Hello and welcome to this week's live. Hello to anyone that is watching on Instagram. Hello if you're watching on YouTube. I hope you're having a wonderful day so far. Today, I will be sharing some of the hidden benefits of clinicals. So, everyone knows that your clinicals are your chance to finally start putting everything together, a chance to actually see use the skills that you've been learning in class and finally have an opportunity to start working with real patients, right? For the most part, it's a very exciting time, but for some, it can also be very nerve wracking. Nevertheless, clinicals are your chance to put your studying and your hard work to practice. But you might be surprised to learn that there are quite a few hidden benefits to clinicals. There's actually a lot more to a clinical than just practicing the skills that you've been learning in class. So, if you're a student getting ready to go on a clinical, this live training is for you today. So, my goal is to share all of those hidden benefits with you so you can get the most out of your clinical experiences. For anybody new here, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs. I am an APTA credentialed CI. I have worked in a lot of outpatient. I have worked in acute care. I've done oncology. I've done pediatrics. I've done home health. Um, I've done acute care. I think I might have already said that. Most of my career has been in skilled nursing facilities. I was a rehab director for a little while. Now I own a cash-based practice in Florida where I work mostly with gymnasts and cheerleaders, but I'm also the owner of Clinical Connections, which is where you are today. What I'd like you to do, if you are watching live, please type live in the comments. Tell me who you are, where you're from. Same if you're watching the replay, just tell me who you are, where you're from. Let me know if you're watching live or replay. Just like to know who I'm talking to. So let's get started on those hidden benefits of your clinicals. So, the very first one I want to talk about is networking. So, the rehab world is actually kind of small in that everybody knows somebody in the rehab world. Okay. Everyone has a connection to another PT or another OT. They have a connection to another clinic. They have a connection to rehab directors. They have connections to other hospitals, facilities, um, networks, rehab networks. Okay. So your clinical is actually an opportunity to make a good impression on everybody at that clinical site. A good impression with your CI, a good impression on the other PTs and OTs at that site, a good impression on the manager at that site, right? So you got a lot of people that you want to impress. And it's important because these people talk to each other, right? It's not that hard. A lot of people. How many people were are in your PT class right now? Anywhere from probably 25 to 100 people. So when you graduate, you know that many people. You know where they work, and you know how to contact them. So it's the same for your CI, your manager, the other clinicians that work at that facility. They all know each other, and they're going to talk to each other. Okay, they can share information about you to other people that they know in the rehab world. They can refer you to other clinics or future employers. They can be a reference for you on future job applications. So each clinical experience is really the opportunity for you to make connections for your future, especially in the terms of employment. So the more positive connections that you can make on your clinicals, the more opportunities you're going to have down the road. So when you're on your clinicals, make sure to make positive connections with as many people as you can at each clinic, facility, or organization that you find yourself doing clinicals at. Okay. This is your chance to build relationships with people you may want to work with in the future. So take advantage of it. Okay. The next hidden benefit to clinicals is that it's likely a job interview. Okay. So, very similar to the last benefit of networking and making connections, a clinical can be a job interview if you're interested in working in that clinic or that facility. This is your chance to show everyone in that clinic the type of employee that you would be. Trust me, your CI and the clinic manager or the rehab director are watching your work ethic. Okay. When I was a rehab director, a majority of the hires had been past students at our facility because watching them as a student gave me more information about them than their interview did. Okay. Literally, like 90% of the people that I hired full time and even as PRN had been students at our clinic, at our facility. because I knew what type of employee they were going to be. A clinical allows you to show them your clinical reasoning, how you handle stressful situations, your time management skills, your communication skills, which are very important, how you work on a team, your documentation skills, so much more. Basically, your clinical gives you a chance to show them more about yourself than can be portrayed on a resume or during an interview. So approach your clinical experiences as physical job interviews, okay? This is your chance to literally show them your stuff, which is especially important if your clinical site is actually a place that you want to work at in the future, okay? So make sure you shine on your clinicals. The next hidden benefit is the opposite of that. So a clinical allows you the opportunity to see how that clinic or that facility runs. Okay. This will give you information about whether or not it is a place that you want to work or not. Okay. Clinicals or facilities might look nice and shiny on the outside, but once you actually spend time on the inside and you learn about all the inner workings of that clinic, it might not be so shiny anymore. So take advantage of that. A clinical allows you the chance to learn more about that organization. How is the manager or the boss? Is that somebody you want to work for? Does the team get along? Do they work well together? Do they not like each other? What's typical day like in that clinic? What is the documentation? What's the productivity like? Do the therapists feel supported or is everybody angry and burned out? So, like, pay attention to all these other things while you're on your clinicals. As I mentioned before, the manager is watching you and evaluating you as a potential employee, but you get to do the same thing and watch them and evaluate that clinic as a potential employer for yourself in the future. Additionally, you get to learn what you like and what you don't like about how clinics and facilities are run or managed. So if you don't want to work at that clinic specifically, you can learn what you do like about it and keep that in mind when applying and interviewing at other places. Or conversely, you can pay attention about what you don't like about it and look for that when you interview at other places. Okay. Employers can be really, really good at telling interviewees and applicants what they want to hear. But as a student on a clinical, you get to see firsthand the truth for yourself. Okay. So pay attention to these things on your clinicals. You can learn a lot about how an organization is run. Okay. The next hidden benefit of a clinical is learning what not to do. Okay. So just about every student looks forward to their clinicals as a chance to learn what to do, how to work with their patients, how to apply what they've been learning to actual people, right? There's a lot to be said about learning what not to do. I had some pretty good clinicals when I was a student, but I also had a pretty bad one. And it was one that resulted in a ton of stress, so much frustration, a lot of tears every week. I didn't learn a ton of good patient care skills on that clinical, but I learned a lot of what not to do. I learned how not to talk to physicians. I learned how not to talk to students and how not to treat students. I learned that there can be two different therapists with two different approaches, and both of them can achieve positive outcomes with their patients. So while you might expect to learn a lot of things to do on your clinicals, keep in mind that another benefit to going on a clinical is learning what not to do. Okay. But this does have to come with keeping an open mind, meaning you have to be open to learning as much as you can. Then have the ability to choose what you want to take with you and what you want to leave behind from that clinical experience. Okay. Clinicals can be both a very fun and a very scary time, but there are a bunch of benefits to your clinical experiences, especially those benefits beyond the application skills that you're going to learn. So, for those of you that have a lot of fear and anxiety and nervousness when it comes to an upcoming clinical, know that you're not alone and it's okay to feel that way. I have been there. Like I mentioned, I had some good clinicals and I had some bad ones. Clinical education is pretty much the wild card of PT education. You really don't know what you're going to get, right? You could get a really good CI that is supportive and teaches you and is committed to you, or you could end up with a bad CI on day one who says, go ahead, there's your caseload. Okay. You don't know what you're going to get. You can end up in an awesome clinic, or you can end up in a clinic where you have to see 4 patients an hour. You don't know. Because of this, this is why I created my Conquer Your Clinicals course. Okay, it's A 6 module self paced course helps you prepare to thrive, not just survive on your clinicals. So it covers everything from how to prepare for your clinicals, how to communicate best with your CI, um, insert information about in services, and so much more. It was built from my negative experiences as a student so that I could help other students crush their clinicals without having that fear of not, oh my God, am I going to pass or am I not? Right. So if you're interested in learning more about that course, please drop clinicals in the comments below. Send me a message. I'll send you all the information about it. At the very least, I hope you learned some new hidden benefits to your clinicals today and how to really take advantage of your clinicals aside from putting everything that you've been learning to practice and working with real patients. Take advantage of everything else that your clinicals have to offer. I hope you learned something new today. Please go ahead and drop in the comments your aha moment, something that really stood out for you, something new that you learned. I want to thank you for watching, whether you're watching on Instagram or whether you're watching on YouTube. If you have any questions about anything that I talked about today, please feel free to send me a message or drop it in the comments. I will definitely come back and answer. And I will see you next time. Have a good day.